Good afternoon, everybody. It's Friday afternoon. It's 2 o'clock, which means it's Fertility Talk Live. Today, we are chatting to Karen again. So you guys should know Karen by now. Karen is from Lamelle. And today we are discussing male infertility, but it's not your normal male infertility product that we're discussing. We are discussing male pre-locks. And so thank you, Karen, for inviting us. And we're very interested to hear what you have to say about male pre-locks. And especially male pre-locks, the reason why it's important, especially when it comes to infertility, is because when you're dealing with infertility, there's a lot of pressure, I would say, on a male to perform, because the male just get told, we need to go and do the deed now because doctor said we have to do the deed. So there's always a lot of pressure on men, and we also have to consider them. And I always say that they also in it with us. They might not be able to show that it affects them or speak about it, but it does affect them, and we've always got to consider them in everything. So yeah, I'm going to leave it to Karen. She's the expert on all these things. So yeah, excited to hear. And so guys, if you have any questions again, please put it in. We're going to try and keep it as clean as possible for Facebook. But it's something that needs to be spoken about. So if you have any questions, please just put it in the comment section on Facebook, and Karen will be able to answer your questions. Thank you again, Karen.
It's an absolute pleasure, Lee, and thank you very much for having me on your site today to chat a little bit more about male infertility. So I know that I'm sure that you all know the statistics. I mean, you're following the infertility page, so I'm sure that you do know that have the data at your fingertips. But I think that there might be someone here that's new, so I'm just going to chat a little bit about incidence. So we know just globally that 10% of couples will struggle to fall pregnant. And this is a fact. And I know that we hear a lot about people who are struggling, but so 1 in 9 couples will struggle to have a baby. Of that, and this is another devastating, or that's a high number. I know it doesn't sound like a lot, but it's quite a high number for something that should just happen. Another statistic that we know is when we look at those couples, between 40 and 50%, depending on where you're looking at it geographically, between 40 and 50% of the cause will be the fact that the man isn't producing good sperm. So here I'm not talking about the statistics of afertility. I'm talking about the fact that there is some sperm, but they might not be enough, right? In the first place, the concentration, the amount of actual liquid might not be enough. There might not be enough sperm in that liquid. Some of them might be a little bit strange. They might be strange forms. So their morphology, we talk about their morphology, might be a little bit off. They might not be swimming in the right direction or swimming fast enough. So it is very important that when we are looking at creating healthy pregnancies, that we look at the quality of sperm and we make sure that we're giving the pregnancy or the chance of fertilization the best option that we possibly can. And when my rep always says, if you only need one, there might be 1 million produced, but you only need one healthy sperm. And that's really where the pre-locks fertility comes into the picture. Is so just to talk about the trials. So what they found I'll talk about the supplement just now, but what the trial said was that if you take the combination of the ingredients, pycnogenol and L-arginine, and you take this for a period, now we always look at 74 to 80 days. Why? Because it takes 80 days for you to reform all the sperm that has been formed. So we're making healthy new from the beginning. Everything's now fixed. All right. There is data that supports that within a month there was improvement, but I wouldn't say look at using it for a month and hoping that you'll have a successful pregnancy. You have to take it for probably at least 4 months, I would say. But what they found is that the amount of actual liquid improved. So there was more liquid being improved. 83% improvement in concentration of sperm was found. The motility of the sperm was improved by nearly 60%. And the actual form of the sperm was improved by 93%. Now, why is that? Well, what we've done is we've combined a very fantastic, what's called a super antioxidant, which is pycnogenol. We get it from pine bark extract, with an amino acid called a gyroline. Now, that combination has two functions. The one is it increases the blood flow and it makes sure those veins and arteries are nice and open. It increases the nitrous oxide in the tissue, so it also increases the oxidization of blood inside the blood flow, so you have better blood flow to the area. So of course you're going to do better because you're getting better nutrition to the area where the sperm are being formed. You're also getting more toxins being removed, and so that whole process works better. Then we also know that all of us have a what we call a high risk of oxidative stress. What is oxidative stress? It just means that you're not taking in enough antioxidants to prevent or to neutralize the amount of free radicals that are in your body. And we know that sperm have a little capsule around them, and that capsule is very easily damaged by free radicals. And they're thinking that that's probably why, in many cases, some of the sperm are misformed, because their actual capsule was damaged in the process of being formed or even after they were formed. Of course, if we can put a super antioxidant into your bloodstream and we can keep it there for those 80 days, we are protecting the newly formed sperm so much better. And that's why you see that fantastic stat of 93% improvement in form of the sperm, right? So this data really supports the taking of, it's a natural product. It's not going to, so if you are on other chronic medication, or if you are worried about other challenges, this isn't going to interact with your medication. You don't have to, it contains no animal products. We're not changing your hormones, which is very, very important, all right? We can't do that with a supplement, that we're not allowed to. And so we're giving you a natural product that will increase your success in creating a successful pregnancy. And that's really what it's all about. Sounds like rocket science on one side, but it's actually not too difficult. It's just phenomenal.
That's absolute great.
Okay, questions.
Yeah. So I'm actually looking, I'm trying to, while you're busy, I'm trying to check my phone, because I literally have, so I am not, I'm just check. Sorry guys, I have to do it this way. Let me see. Do we have any questions yet? Okay, we've got people on board and we've got people liking. We've got no questions yet. And normally after I finish the live video, then we normally have questions after that. I'd like to speak about, we spoke about how it helps, couples trying to conceive, in a sense of helping male performance. So it's not a little, sorry, I would like to say it's not a little tablet that you're going to get at a shop somewhere. It's more of a natural ingredient. If we can just talk about that.
Okay, so if we look at, so at Lamelle, we actually have two products. We have a fertility product, and then we have what we call male enhancement. Now, when you look at the product's ingredients, you'll see that they are they're the same, right? Yeah. Why did we put them in two boxes? Are we strange? Are we off our mind? Now, if you look at me, you can see I'm over 50. Now, if a man comes into my house with a little box and says, oh, honey, this is going to help me perform, but it says infertility, I'm going to throw you and the box out.
Yeah.
Okay. On the other side, if you decide you want to have a successful pregnancy, but your wife might not be right there, and you bring a box in that that's talking about enhancement. So we have packaged them in different boxes, but they are the same ingredients. The advantage is the fact that it's going to help with enhancement as well as sperm quality. So it is not the little blue tablet. Okay.
Yeah.
It's not an action quickly 4 hours and then it's over. So you're not going to have to take a temperature, run, quickly take it, hopeful, and get there. And okay, I'm ready. All right. So you don't have to duplicate. You don't have to take both. The data supports the dosages that I'm giving you for both.
Yeah.
So if you are taking the Prelox fertility product, you will find that you're able to perform much better. Your erections will be improved, all right? But it's not a question of, and this is very important to me, is not the fact that you're wandering around and you've got a permanent erection. I'm just going to put it out there. But what you do have is you will respond much better if there is initiation. So if you need to get into the mood, you'll get there more easily. All right. So I'm not going to, which also the whole situation where, oh my word, you have to perform. I know it happens, honey. You have to come home right now, immediately. And I can think that for both partners, there's a massive amount of performance anxiety for everyone, because it's not something that it isn't something that well, for some of us maybe it's something that naturally happens, just but I think, and especially in the stressful environment that we're living, and then adding the stress of having to perform immediately, the product will definitely help with that as well. So you only take your Prelox Fertility, 2 capsules a day. Preferably with something in your stomach, because when we look at capsules, the only reason why we say that is the capsules, they are veggie caps. So halal, kosher, and vegan, which we seem to have to mention. I sometimes forget to mention, but the capsules sometimes create a lot of irritation in your tummy if your tummy doesn't have anything in it. So have it with your yogurt in the morning, and take them regularly every day. And because they're natural extracts and because it's an antioxidant, you can actually take it for the rest of your life if you do feel up to it, or if you need to.
Great.
Does that answer your question?
Yeah, no, that definitely answered my question.
Very long.
Because one of the ladies said to me, it's actually a friend of mine, but she's also dealing with infertility, and she said, how do I, I'm just going to put it in my husband's food. I'm like, you can't do that. She's like, yes, because I'm ovulating now and I need to get this, because that is exactly what happens. And you go home and you try to figure out, how am I going to tell my husband that tonight is the night I'm ovulating? So do I leave a little message somewhere or something like that? So these tablets would definitely help. It could be, maybe it's bringing a little bit of excitement.
You can't do Barry White and the rose petals and the bubble.
Exactly.
Bubble bath every time for 3 days. Man.
Exactly.
Getting pregnant will cost more than the pregnancy.
Exactly. So yeah, it is definitely a struggle, which is quite nice. So ladies, get your husband to take some.
I am taking. All right.
Okay. Sorry.
And in many cases, what no, not at all. I don't want to think that people I don't want people to think that I'm making light of it. I understand that it is just it is, and I can't talk from my own experience, but I see it happening around me. It's such hard work. It becomes such hard work. And we really want to, it needs to be a little bit natural again. And I think really that the Prelox products do help with that. So definitely a phenomenal add-on. What I was going to say is, what a lot of girls do is they go, honey, this is a good antioxidant. You have to take them every morning. And she just feeds them to him every morning, They are blue and red. You could call it the blue and red tablet, but yeah, it's just you. This is for your health, and we also know that just on the sidebar that it does improve vascular health as well. And I'm sure that you do know. I don't know that you do know. You might know this, but generally, where we have men who have erectile dysfunction or dysfunction in performance, we also start looking at cardiac disease.
Okay.
So a very important point is that if you are fine, if your man is not doing well, and you can't relate it to lifestyle, sometimes it's medication that causes it as well.
Yeah.
You have to maybe take him, or maybe send him to the cardiologist just to have his heart checked out.
Okay.
Because especially and we always go, but it's men over 50. No, honey, at the moment it's actually guys who are much younger. We're seeing this kind of dysfunction in 30-year-olds, and it's related to stress, it's related to lifestyle, it's too much alcohol, too much partying, and of course diet that isn't high in product. Just balanced diet will also affect that. So we have to look at lifestyle. And this isn't no Prelox product. No tablet is going to replace a good lifestyle. So we have to look at that as well. But yeah, if you are, just a reminder, if there are guys or girls online, I can't see who's online. If you are having challenges and it's becoming a problem, please have your heart checked out as well. And on that, Prelox helps with vascular.
Oh, so are you saying that it would be okay for someone that's got a high blood pressure? I don't know what the medical terms. So they can take it if they suffer from that.
Yes.
Okay.
And what we also find.
Yeah. Go ahead. Sorry. Go ahead.
So we do find long-term use improves blood pressure, and it also improves the actual plaque if there is any plaque on the arteries and veins, it actually does get rid of that. So that's just from the pycnogenal trials. We know that that's improved. And of course, if there's less plaque, so it's it's nearly like the plaque we get in our teeth, though it's not carbon. I mean, that it's not hard. It does create a situation where the arteries and veins aren't dilating and contracting properly, and that will also help. It will also improve if you take, but that's with long-term use. So I'm looking at longer than 16 weeks.
Okay. You were saying earlier that you don't want to make light of it, but sometimes that is our way of coping, because I'm talking about it because I know that's exactly what I went through. And I would come home and, sometimes it would actually end up in a fight. Because all you're wanting is for everything to go perfect, because you're thinking, this is it, this is the night we're going to do the deed and I'm going to fall pregnant, because that's all that you have in your mindset. That's all you think about every day, all day. And you come home and you put this pressure on your husband. And in his mind, because he's being told he's got to do it, instead of, I think men as more of we think of them, it's like, they need to take everything, they're wild, they still got that in them, if you think of those years. And you telling him that, okay, you need to perform. It's like you just can't tell a man. So it does cause problems. And sometimes we women, we have to laugh about it and make light of it, because it's the only way. It's our coping mechanism at the end of the day. As couples dealing with infertility. So I completely understand that. And the other thing I was going to say is that what I used to do is I used to take the medication out in the morning and take my medication, and I'll say, yeah, you must take this. Did you take your meds? Don't tell him what it's for. Just say, just take your meds. It's vitamins, whatever. You must take your vitamins today. And I put it out there with all his vitamins and made sure he takes it. So yes, that's what we definitely can do. I'm trying to see if there's any, it's very difficult, sorry guys, with doing it this way, but it's the only way these days. I'm trying to see, I don't see any comments yet, and there probably will be when everything is finished and then the comments will come through. But if you need to get a hold of us, please, you can contact Karen. She's from Lamelle. You can email lamelle.co.za, am I correct? You can go onto the website, and the products are
So
available.
yeah, go on.
Yeah, sorry. The products are available on.
Go on to our website.
You go ahead.
Yeah, so our email address is easy, www.lamelle.co.za. And there is a question and answer, or a question post. The guys at the office are very good at answering questions, but if there are any challenges, they will come through to me, so you'll get an answer from me.
Okay, great.
Or you'll get an answer from Annette, who's our other specialist in these products. You're also welcome to contact us. The products are available in pharmacies. And if they're not in your pharmacy, please ask them to order them, because the wholesalers have all our product ranges.
Okay.
So I know that they're in Clicks, they're in Spar, they're in the independents. So no challenges with that. And you can also get them online directly from Lamelle.
Okay.
So there are many options to get the products to you.
Okay, so I actually got an email from somebody requesting your products from Namibia. And we're starting to get a lot of couples from Namibia actually watching our live talks and stuff and asking questions. So is it available in Namibia, or can they then just get it by ordering it from your website?
Yes.
Okay.
Yes.
Okay, great.
We actually have a distributor in Namibia.
Okay. Perfect. So if you guys didn't know, Lamelle has the pre-locks, the male pre-locks, and they also have Ovadia, which is for women dealing with PCOS. It's a great product, Ovadia. If you don't know about Ovadia, you can actually go and have a look at our previous talks. We spoke about Ovadia. So if you're dealing with PCOS, Ovadia is a great product for that, and it's actually very reasonably priced. The other product they have is the lady pre-locks, and it's kind of in the same boat as where male pre-locks is. So we've also done this talk about that as well, so you guys can have a look at that talk. So yeah, I just want to say thank you to Karin. Again, we've been doing so many of these talks now, and it's really great to always have you. And we hope to chat to you soon. Hopefully in the new year we get to chat soon.
Fantastic. And I hope that there are lots of successful pregnancies
definitely
in this festive season.
Yes. Yes, thank you very much, Karin. You have a great day and great weekend.
Thank you.
Thanks.
You too.
Bye.
Okay. Bye-bye.